Hi guys, welcome to my channel. I will be teaching you what are coagulants and anticoagulants. Coagulation. It is also known as clotting. Clotting is a process by which blood changes from a liquid to a gel, forming a blood clot. इसमें क्या होता है, जो लिक्विड है ब्लड दैट लीड्स टू द फॉर्मेशन ऑफ जेल दैट इज सेमी सॉलिड. ये कंप्लीटली लिक्विड भी नहीं है और ये कंप्लीटली सॉलिड भी नहीं है. दैट इज अ जेल. एज यू कैन सी इन द इमेज देयर इज एन इंजर्ड ब्लड वेसल. दैट इज रिलीज ऑफ ब्लड. वहां पर वो इंजरी हुई है तो वो ब्लड रिलीज हो रहा. नेक्स्ट इन द नेक्स्ट यू कैन सी दैट द प्लेटलेट प्लग फॉर्मेशन. यहाँ पर WBC will start releasing out. As you can see in the image, the blood vessels that is RBC वो बाहर जाना स्टार्ट हो रहे. नेक्स्ट यहाँ पे फाइब्रिन जो रहते हैं, यहाँ पे जो फाइब्रिन्स है दैट इज प्लेटलेट्स, वो एक बल्क फॉर्म करना स्टार्ट करते. एज यू कैन सी अ बल्क ऑफ WBC दैट इज फॉर्म क्लॉट. ये क्लॉट फॉर्म हो गया. सो दिस इज कोगुलेशन. ब्लड क्लॉटिंग इन्वॉल्व 3 स्टेजेस. इसमें 3 स्टेजेस हैं ब्लड क्लॉटिंग में. सो द फर्स्ट इज thromboplastin formation. First is thromboplastin formation. Second is conversion of prothrombin to thrombin. Conversion of prothrombin to thrombin. And the last one is conversion of fibrinogen to fibrin. So as you can see in the image, the first stage. So first stage में क्या हो रहा, endothelium is ruptured. उसमें क्या है, endothelium जो है ruptured है. Then वहाँ पे platelets attached to endothelium. Next stage is platelets start to release fibrin and begin to seal the endothelium. Endothelium क्या है, blood vessel wall है. Okay, endothelium is blood vessel wall. This will form and release fibrin. Fibrin is protein. And the third stage is that fibrin will try to make a network. As you can see in the image, वहाँ पे एक network form करता है and that will trap WBC. It will start trapping WBCs and this leads to the formation of clot. So these are the 3 important stages of clotting. In the first stage, it will lead to the try to attach the platelets. Second stage में it will form and release fibrin, and in the third stage it will try to trap WBCs and forming a network of polymers, fibrin polymers. So these are the 3 stages of blood clotting. Coagulants. Coagulants are the agents used in the treatment of severe hemorrhage causing coagulation of blood. Examples of coagulants are thrombin and menadione. So these are the 2 examples of coagulants. Hemorrhage. What do you mean by hemorrhage? That is release of blood from a broken blood vessel, either inside or outside the body. इसमें क्या होगा, blood will flow inside your body, that is hemorrhage due to severe injury. As you can see in the slide, it may be in the brain or it may be in eyes, mouth or any organ. That is hemorrhage. First drug is thrombin. It is a sterile protein substance prepared from human plasma and is freeze dried. ये क्या है? Human plasma से मिलता and that plasma contain RBCs, WBCs, platelet as well. It is about 55% of the blood. Next, it is cream colored powder. It is cream color powder. That means it has a cream color, off-white color. That is cream color powder. It is soluble in saline solution, giving cloudy pale yellow solution. जैसे आप इसको soluble करते हैं saline solution में, तो it give a pale yellow solution. जैसा वो cream color का है, लेकिन आप जैसे उसको saline solution के साथ react करेंगे, it will changes to yellow solution. It is thermolabile. That means it is affected by heat. Next point, it is affected by air, heat and light. आप अगर इसको open air में रखेंगे, it will degrade and that causes instability of the drug. Hence it is stored in atmosphere of nitrogen. एक ऐसे कंटेनर में रख रहे जहाँ पर नाइट्रोजन प्रेजेंट है. In a glass container which are sealed so as to exclude microorganism and moisture. ऐसे कंटेनर में रख रहे जहाँ पर moisture पास नहीं होता. Next, the container are kept at a temperature between 2 degrees and 8 degrees and are protected from light. That means इसको freeze करने के लिए हम 2 degrees or else 8 degrees पे इसको रखते हैं and it is protected from light. It should be at 2 degrees maximum. Next, the solution of thrombin should be used within few hours and are not to be injected. Next, uses. It is useful as a coagulant. First, topically to control minor oozing. Oozing means bleeding due to superficial cut. Superficial means एक ऐसा cut हो रहा आपकी बॉडी पर जो deep cut नहीं है. It is on the skin, not in the inner layer of the skin. That is superficial, as you can see in the image also. An injury. Next, orally to prevent gastrointestinal bleeding. It is used for gastrointestinal bleeding. In next point, in combination with matrix like fibrin foam or gelatin sponge, it is useful to prevent more extensive or inaccessible hemorrhage. Basically, it is used for hemorrhage. Hemorrhage is bleeding inside or outside the body due to injury. That is hemorrhage. Second drug of coagulant is menadione. So, as you can see in the slide, the structure of menadione. And its chemical name is 1,4-diacetoxynaphthalene. Properties. First, it occurs as white crystalline powder. As you can see in the slide also, there is a picture of a white crystalline powder. Next, it is odorless. Odorless means it doesn't have any smell, aroma, मतलब कोई खुशबू नहीं है इसमें और कोई बदबू भी नहीं है. That is odorless. Or has a slight odor of acetic acid and has a bitter taste. Maybe ये odorless हो सकता और else इसमें थोड़ी सी acetic acid की odor present है. It has a bitter taste. Bitter taste मतलब कड़वा taste है इसका. Next point, it is very soluble in water and in cold alcohol and in acetic acid. सो बेसिकली ये वाटर में सॉल्यूबल है, कोल्ड अल्कोहल में सॉल्यूबल है और एसिटिक एसिड में सॉल्यूबल है. सो दीज आर द प्रॉपर्टीज फॉर मीनाडायोन. Uses. It is used as nutritional supplement and for the treatment of hypoprothrombinemia. Hypoprothrombinemia means that is a blood disorder. Next point, it is used as nutraceutical. Nutraceutical, that is a nutritional medication. Nutraceutical is nutritional medication. Next, dosage form. It is available in tablet or in injection form. Next is the brand name. Amycin and Pernevit is the brand name of Menadione. Anticoagulants. Anticoagulants are the drug which delay blood coagulation. That means they delay the coagulation time. As you know, coagulation time is about 70 to 180 seconds. So this will delay the time of coagulation. Next, they prolong the coagulation time of the blood. They are used to prevent thrombosis, that is coagulation, blood clot after operation or from other causes. Coagulants are divided into two groups. First, direct, that is example is heparin, and the second is indirect, that is coumarin is the example. Warfarin, sodium and bis hydroxide coumarin is the example of indirect anticoagulant. First drug of anticoagulant is warfarin. Its properties: warfarin sodium is white crystalline powder. So it is available in white crystalline powder. Next point, it is odorless and has a slight bitter taste. It is odorless, that means it doesn't have any smell, and has a bitter taste, that means इसका थोड़ा सा कड़वा taste है. Next point, it is very soluble in water and freely soluble in alcohol, but very slightly soluble in chloroform. So basically it is soluble in water. जैसे आप वारफरिन को लेंगे और पानी में डालेंगे तो ये डिसॉल्व हो जाएगा, that is soluble है water में. Next, stability and storage. It is discolored by light and air. जैसे आप ओपन में रखेंगे, बेसिकली ये वाइट कलर का क्रिस्टलाइन पाउडर है. इफ आप इसको लाइट में या एयर में रखेंगे उसका कलर चेंज हो जाएगा, दैट इज डिसकलर्ड ऑफ वारफरिन. इसका कलर ब्लैक हो जाएगा और एल्स येलो हो जाएगा, पेल येलो हो जाएगा. सो दैट इज डिसकलरेशन. हेंस इट इज स्टोर्ड इन टाइटली क्लोज लाइट रेजिस्टेंट कंटेनर. ऐसे कंटेनर में स्टोर करें जहां पर लाइट पास नहीं होती. नेक्स्ट, यूजेस. It is used for the prevention and treatment of deep vein thrombosis and pulmonary embolism. Deep vein thrombosis मतलब clotting of blood in the veins. Next point, it is used to prevent myocardial infarction, that is blockage of blood flow to the heart muscles. इसमें क्या होता, हार्ट मसल्स के जो वेन्स है वो ब्लॉक हो जाते हैं, वहाँ पे क्लॉट फॉर्म होता, दैट इज मायोकार्डियल इन्फ्रैक्शन. नेक्स्ट पॉइंट, इट इज यूज्ड टू प्रिवेंट सिस्टमिक एम्बोलिज्म, दैट इज हार्ट ट्रांसप्लांटेशन. Next point, some time to treat peripheral venous thrombosis, that is blood clot. Next, it is used as rodenticide. Rodenticide means rat poison. It is a chemical used to kill the rat. Next, dosage form. So basically it is available in tablet and injection form. Warfarin is the brand name of Warfarin. Warfarin is the brand name of Warfarin. Second drug of anticoagulant is heparin. Heparin is available in white or creamy white, moderately hygroscopic powder which are freely soluble in water. So ये white color का powder है, hygroscopic है, that means it will absorb moisture from the surrounding and it is freely soluble in water. So these are the properties for heparin. Next is the stability and storage. The aqueous solution are stable at least 7 years at the pH 7 to 8. ये 7 years तक stable है at the pH 7 to 8. ये pH maintain करना पड़ता, 7 to 8 pH maintain करेंगे, then only the drug will be stable. Next, it is stored in sealed containers so as to exclude microorganism and moisture. That means ऐसे कंटेनर में रख रहे जहाँ पर moisture और microorganism नहीं है, and it will not attract also. Next is the uses of heparin. First, for prophylaxis and treatment of deep vein thrombosis and pulmonary embolism. Next, for prevention of thrombosis. First, during hemodialysis. Hemo means blood and dialysis. Dialysis means it is a treatment that will filter and purify blood using a machine. इसमें क्या करते, जो आपका blood रहता है वो clean करते, purify करते, and it is done by a machine. So this is called dialysis. Next, during open heart surgery and vascular surgery. So heparin is used during open heart surgery. Next, during blood transfusion, that is transferring of blood, heparin is used. Heparin is available in injection form. So the dosage form of heparin is heparin injection. So this is deep vein of the leg. In the first you can see the normal blood flow, and in the second image you can see deep vein thrombosis, that is coagulation. In that vein coagulation is start forming and this lead to embolus, that is deep vein thrombosis, and this causes swelling, redness, pain in the legs. So this is deep vein thrombosis. Third drug of anticoagulant is Dicoumarol. It is available in white or creamy white crystalline powder. Next point, it has a faint pleasant odor and has a bitter taste. It is insoluble in water and soluble in chloroform and alkali hydroxide. It is discolored in the presence of air. आप इसको जब ओपन एयर में रखेंगे ये उसका जो वाइट कलर है वो चेंज हो जाएगा, that is discolored. Hence it is stored in tightly closed and light resistant container. ऐसे कंटेनर में स्टोर करें जहां पर लाइट पास नहीं होती, that is light resistant. Uses, it is used for myocardial infarction, systemic embolism, and it is used for deep vein thrombosis. वारफरिन के जो यूजेस है सेम यूजेस है ये ड्रग के भी, that is Dicoumarol. Dosage form, it is available in tablet and injection form, and the brand name is Dicoumarol. So this is the anticoagulant drug. Thank you guys for watching my channel, and if you like, please subscribe to my channel and hit a like button. Thank you.